Hi, my name is Sarah Martin. I'm a commercial relationship manager for SunTrust Bank, and this is Sylvia Fields. She has an amazing story, and I learned about her story at my Rotary group. I'm a member of Savannah Rotary West, and she came in and spoke to us about her story, and I'm so inspired by her, and I would love for her to tell you all about it.
Well, good morning. My story is long. I want to tell you that I came to the Rotary Club to talk about my Florence Nightingale and her influence on healthcare today, and how our nurses in the hospital are working, so hard, and they're fatigued, and they're not getting time to do research, outcomes research, which is necessary for them in order to have the hospital be reimbursed appropriately by the federal government. So I initiated the Nightingale Scholars Project. And the Nightingale Scholars Project is a fund that I established with the help of my dear friend Alice Jefferson, to be able to raise some money to help with the education of the nurses and the doctors working collaboratively. And it's to improve patient outcomes through collaborative research. So I came with the slides about the brilliant Florence Nightingale and her wonderful statistics that brought the mortality rate of the soldiers in Crimea in the 1830s and 50s, 40s, 50s. I guess I've messed up the dates. Anyway, from 40% mortality rate to 2%. And as a nurse, she brought this, and no, there was no real training for nurses in this day. So she was the first person who established the first formal nursing program in England, and then was a consultant all over the world, of course, throughout the Commonwealth and during the Civil War to the United States. And so within several years, there were 1,000 nursing schools in hospitals modeled after Florence Nightingale. So I came to talk about Florence Nightingale. And in the course of it, of course, I have a very interesting story.
Yes.
Ask me how I happened to become a nurse. It's a fluke. It's an absolute fluke. I didn't know anything about nursing. I was 16 years old, a child of immigrant parents, the first in our family to go to college. But I wanted to go to college, and yet I thought I wanted to get out of Brooklyn, where I was living in this tiny 3-room apartment, and experienced guests that we had often who were Holocaust survivors, and I had to move from the bed that was a sofa bed, in a sense, I shared with my brother, who was 5 years older, in the hallway of that tiny apartment. I had to sleep on the floor in my parents' bedroom. So I wanted, I really wanted more out of my life. I wanted adventure. I wanted education, but I wanted adventure. I wanted something different. I didn't want to be like all my friends who were probably getting married right away. This was the early 1950s. So I was 6 months away from graduating. I was only 16. And I said to my counselor, no more math. I don't want to take trigonometry. I need a half a credit. What course can you give me so I can graduate in June? It was 1950. And so she said, well, take this home nursing course. You'll like it. You'll learn things and you'll get an A. It's good. So I said, as long as there's no more math, then I'll take that course. Well, lo and behold, the teacher, this nurse, first nurse I ever met and talked to, was marvelous. And it was interesting. It was not like any other course I had taken in high school. And it was a wonderful high school. I have to add this. I graduated in 1950 from James Madison High School in Brooklyn, New York, in the class with Ruth Bader Ginsburg, Supreme Court Justice. beautiful, beautiful. And sometimes I'll show you the pictures of her when she was young. She was beautiful. She's still beautiful and brilliant and lovely. Anyway, it was a fluke. Mrs. Quinn, the teacher, said, "You know, Sylvia, you're smart and you're caring. You would make a good nurse." And I said to her, "But you said you have to be 17 to go into one of the hospital schools." She said, "There's a college out on Long Island." I says, "My parents won't let me sleep over. I'm too young. They won't let me go away." "No," she said, "you can take the subway and the Long Island Railroad, and you can go to Adelphi College. Then it's now a university." But so my brother was in the Army, and when he came home on leave, we went we took the subway and the train, and we went to see this beautiful campus, lovely, lovely school, very small, and we talked to the dean of the School of Nursing, and she welcomed me, and when she told me about the program, at the end of the second year, I would be able to we would move into the nurse's residence, and I would finally have a room of my own. Actually, my new book that I've just published, which is called "Everything is Possible, a Nurse's Memoir," was supposed to be named "All for a Room of My Own." So it's a remarkable story, because it's now over 60 years, and I have had an unbelievable experience in my life. I did graduate from Adelphi. I got a BSN at that time, and then I went to work at Mount Sinai Hospital in New York City as a staff nurse, and that was a fascinating experience, working with some outstanding physicians. And then I got married, and my husband was coming out of the Army, and he wanted to go to law school, so we moved to Boston, and I applied for a job, and because I had a degree, they asked me to teach. Wonderful, wonderful Mass General Hospital. I love that institution. It's where they first experienced ether. It's called the Ether Dome. It's a very large, where they first demonstrated the use of ether for anesthesia. But it was a wonderful school, a wonderful students, very bright students came from all over the country. And then I accidentally got pregnant. I still can't figure out today, as smart as I was, I don't know how I accidentally got pregnant. And that was not in the plan. But I kept working, and I had this wonderful child, Melissa. She's now 60 years old. Can you imagine?
Oh my goodness.
My daughter is now 60 years old. But she's beautiful. I have two more children. Andrew is 56 and Elizabeth is 52. And
Did you know how those came along?
By this time, I knew it. The other thing is that it was a very difficult time in our lives. But so I had to go back to school, work, raise my child with a struggle in a marriage. Over 20 years, I took courses at Columbia University because we had moved back to New York, and I was teaching in another diploma nursing school in Brooklyn, Lutheran Medical Center, with their Lutheran sisters, and they loved me. I was the only Jew in this hospital, and on Passover they brought put matzah into the dining room for me, and everybody loved the matzah. So it was an exceptional experience with some wonderful people. And when my babysitter didn't show up, the sisters loved to take care of her. They had a crib that they used to teach the nurses about pediatrics, and anyway, I know this is it's a very long story, but it's leading. I don't want to tell the whole story, but I've been I went to Columbia over 20 years and earned 3 degrees: Bachelor of Arts in I majored in cardiovascular nursing, did
wow.
did clinical work at Presbyterian Hospital, and then I did continued because I had to, for another school that I started to teach in, a 2-year nursing school. They needed somebody to teach maternal child health nursing. Well, it was a brand new school, and the 2 other faculty they had hired had never done pediatrics or OB, and they had not been married. They didn't know anything about parenting and children and obstetrics. At least I had been there. I'd been there. So I agreed that I would go back to school in part-time and take courses, but I took my students first to Planned Parenthood. I certainly learned that planning your child is a lot smarter, and I support Planned Parenthood 150%. So then I was recruited to, while working on my doctoral degree, and I was recruited to the State University of New York at Stony Brook, a brand new health science center. And it was the time of the Vietnam War, and it was the time of the development of the nurse practitioner program. And I am a person who gets an idea and I fly with it. And actually, we were taught. I got a certificate in patient evaluation, and from the medical school, among other faculty, working collaboratively with Dr. Jock Sherman, who was an associate dean of the medical school. And then he said, we need to have a textbook. We need to have a book for nurse practitioners that are going to need to know how to do, physical examinations. And so he assigned the faculty chapters to write. And I had a dining room table filled with every book ever published on physical examination. And so I did my chapters, and he said, come back in 2 weeks with your chapter. I was the only one who came back with my chapter. The others just couldn't find the time. But I stayed up at night and weekends, and I did my chapters. And so ultimately, when he said, we're going to publish this book, I am the only co-author. The name of the book is Guide to Patient Evaluation by Sherman and Fields, and it won the American Journal of Nursing Award.
Wow.
We did 5 editions of that book over 10 years, and I have to tell you that I sent 2 children through college with that book, with the royalties. I also got introduced to the whole concept of developing educational materials, which was part of my Columbia work, because I was working. I've had so many jobs at the same time. It's very hard to do the whole
And with 3 kids.
And with 3 children, who are. I'm so proud and fortunate, because not only do my children follow me in their GNA, but not DNA, but my grandchildren. I have 6 grandchildren, and they are brilliant. My oldest granddaughter is a technical production director for CNN News. That's
Wow.
Unbelievable. Each one of them, and they range over a 20-year
Good role
period.
model.
Yeah. So
Yeah.
the little one walks around holding the book like this, showing my book to
Oh,
everybody.
that's so cute.
But then I finished my doctoral dissertation. Was a study of interprofessional health education and practice, the healthcare team. It was a study that was developed while I was at Stony Brook, under outstanding physicians that I worked with. Dr. Ed Pellegrino started the Health Science Center with that theme of the healthcare team. And my study was a national study of educational opportunities for nursing students with other professions. Primarily, it's medicine. And so I finished my doctoral degree. It was a miracle because by this time my marriage was ending. And it ended. One day he came home and he had lost another job. And I said, I can't take it anymore. And I left. I walked out with nothing. The first car in the driveway had 99,000 miles on it. And I just said, I'm getting out of here. 3 children came with me. I gave up a lovely home that I had worked so hard to have. But I knew I had to get out. And it's a long story because I was recruited. What's interesting is that I was recruited after I got my doctorate and had been doing a part-time job with the New York State Regents External Degree, developing what is now Excelsior College. I was part of the team writing the performance examinations to help nurses with diplomas to be able to get to their bachelor's degree. And so I was recruited to
pioneer nurse here.
Yeah, I am.
Yes.
I'm pioneering all of this. But I was recruited to Atlanta, to Emory University School of Nursing, as the professor of nursing and director of the undergraduate program. And I was also involved in a very challenging experience, interprofessional experience, because I was the only one who had teaching experience interprofessionally. We had designed an award-winning course on an interprofessional approach to patient evaluation. And it was a marvelous study. There was also, I had been taking courses with faculty at Columbia who were at other institutions and in the process doing the same thing. So we put together the first published article was about preparing faculty to teach in interdisciplinary ways. I have to say this is so many years ago, but it's still a big, major problem every place.
Yeah, elaborate on that.
Studies have shown that when doctors and nurses talk to each other, listen to each other, communicate together, that patients do better. They get educated appropriately. They have shorter hospital stays, and today they have higher scores on the HCAP scores, and that's another whole story.
And what's HCAP?
HCAP is under the Obamacare, and I can't believe it won't stop, evaluating the quality of the care that the patients get in the hospital. And it is a study that tracks patients when they are discharged and asks questions about how well they were treated, how clean was the hospital, how did they respond, the doctors and nurses respond to their questions, to their pain, did they get their pain medication on time, were they treated humanely? And this, it's called, the HCAP scores are Health Consumers Assessment of Health Care Providers and Systems. And every hospital throughout the country must submit the scores. The scores are obtained by following up the patients. The hospital calls the patients or sends them the written questionnaire, or online they are asked questions about their hospital experience. Those scores are compared not only across the hospitals in one city, but across the country. And the important thing is that the federal reimbursement to the hospitals is based on the quality of the reports they get back from patients. And so you have hospitals today losing money right here in our city, losing money. One, because they still have to take care of a lot of patients who don't have insurance, and their have difficulty in tracking their patients, and they're not as satisfied. So the scores aren't good enough. And that's taking me back to the Nightingale scholars. There's a lot more in this story because I did, beside the books, the 5 editions, I worked with a nurse at Emory, one of the nurse faculty members, and many of the faculty members who contributed chapters and questions. We did 4 review books for the national board examinations for the RN, and those review books were on contract with a publishing company that had published Guide to Patient Evaluation, and we paid the nurse faculty members for their contributions, which was done over and above their regular jobs. So this concept of paying for additional work is what I'm bringing to Savannah, Georgia right now, the Nightingale Scholars Project.
So people watching, what would you like them to do?
I'd like to see this program all over the country. Our young bedside nurses have a very short educational experience today in their schools, and many of them are online programs. It's not a personal thing, and what I want is to be able to provide them with continuing education while they have to work. So our plan, it focuses on outcomes research, teaching the patients appropriately for their discharge. Do they know why they're taking this new medication? Do they know what to expect from that new medication? Do they know the side effects? Do they understand what their experience is normal or not? And so the first project is actually the teaching project of the nurses and the pharmacists and the resident physicians how to teach the same exact content so that patients don't get confused.
How are you doing that now?
Well, we've started, it's called scripting. And scripting is a strategy where the language is prepared, posters are put up near the patient's bed. So everybody who comes in repeats it, explains it again, makes sure that the patient understands. And at the same time, what this does is if they do take the medications appropriately and understand it, they're going to have better outcomes and better evaluations of the care they had in the hospital. It's like nursery school. It's really simple kind of process. Unfortunately, today, our patients are sicker than they were years ago. When I was a student, patients stayed in the hospital for weeks and months.
Well, that's a big thing, is we're trying to, or Dr. Fields is trying to shorten the time that we have patients in our hospitals, get the HCAHPS surveys to be better, to get more funding for our facilities. And with that being said, before we wrap up, you are having a book signing, correct?
Yes. we just had our first joint book signing. I have to tell you that in the course of my work, when I've been through so many things, that coming I left Savannah, I left Atlanta and went to work for a publishing company in Philadelphia. And after I met my second husband and married, he didn't want me to travel. So I went to work at Jefferson Medical College. And at Jefferson, I was in the dean's office and in the Center for Research in Medical Education and Healthcare. And there was federal money and state money to help try to interest the medical students to go into primary care. We have a terrible shortage of primary care physicians, and that's in a sense why the nurse practitioner and PA programs were developed. But I worked with the faculty developing the curriculum and in the course of trying to teach students, nursing students, I was in the School of Medicine, trying to teach medical students to be more humanistic and to understand the roles of other health professions. We developed a course, a very quick course, where the nurses taught the medical students about aseptic techniques and about communicating with patients, and they worked together, and as a result, we developed a questionnaire on attitudes, comparing attitudes of doctors and nurses toward collaboration. And that attitude study, this was a questionnaire that we gave to the students before the program and then after the program, to see the differences and to see that doctors and nursing students didn't know very much about each other and didn't appreciate until they had the opportunity to learn together. And I will tell you, the nurses, we have many more female medical students now too. And so that's another part of this working together. But that first questionnaire was in the center of medical education research, and they received physicians, educators from all over the world. The first one who came was from Mexico, and this doctor from Mexico, saw our questionnaire and said, this is really important. We don't do anything like this in Mexico. And she translated the questionnaire.
And you created the
And I created that comment.
Yeah.
Wow. With Dr. Hojat, who's a psychologist.
And what's the name of it?
And
what do you call it? The questionnaire?
The questionnaire is
Dr. Fields, I hope.
Dr. Fields, no. This questionnaire is attitudes. It's the Jefferson scale of attitudes toward physicians and nurses' attitudes toward collaboration. And I presented, we presented the first result of the first study at the AAMC, that's the big medical education meeting. It was very well received there. And then I went back to Columbia, and I presented it at the conference, research conference in New York. And then we published a comparison of the results of the nurses and doctors studies between Americans and Mexicans, and that was published I believe in I forgot exactly which one, but anyway. And then a doctor came from Israel to Jefferson, and he wanted to use the scale, and so they translated it into Hebrew. And then somebody from Italy came and was translated into Italian. Well, that study of the 4 programs showed not just how different they are in the culture and how practice is different. There are now over 40 countries have used and published the results of that study. Well, we were so great at doing this, and
Pioneer, right here.
I know, it's crazy.
The next thing that happened was that my husband decided to retire early. He wanted to play golf. And so I had to move. I loved him, I wanted to keep the marriage, so I had to move with him to Savannah. There were a lot of other places he wanted to go to, but I was going to go to where I knew something. I knew a little bit about Savannah from when I lived in Atlanta, and I knew that there were hospitals and there were schools at both Georgia Southern. Actually, my younger daughter, when I left, she didn't want to go to Emory, and so she wanted to go to Georgia Southern with her friend and major in business. I was in shock because she was going to get a full scholarship at Emory under my faculty role. But she went to Georgia Southern, and she got a very good education in business. And her first job ended up being in New York, and I have a letter written commending her by the dean of Georgia Southern and the head of the bank that she worked in. I'm so proud. That's Elizabeth. She's my baby, my youngest one. And so, anyway, I came to Savannah. Well, I had to learn how to play golf. I had to learn how to play bridge. Didn't know any of those things. But the first thing, I commuted actually for almost 2 years between Philadelphia and at Jefferson and it's terrible, and Savannah. And so during that time, we developed, while I was commuting, working on these projects. The next one was a study of empathy in doctors and nurses.
You started it?
I was part of the group. It's a group now. I mean,
Okay.
we have an interdisciplinary group who was in the medical school. The nurses had a separate thing. They also worked with us, but primarily this is coming out of the Center for Research in Medical Education and Healthcare. So the studies on empathy are remarkable. They have, again, over 40 countries are using the studies of empathy, comparing the nurses and doctors on empathy. And I did a study here, back to being here in Savannah. I forgot. The very first thing I got involved with a volunteer group called the 100. The 100 supports the Baptist Children's Hospital. It's not called Baptist anymore. And they were raising money, and they were putting up new tiles, painted tiles that children had done on the ceilings of the rooms. But I wanted something more meaningful, and I heard my friend, Dr. Shapiro, Patty Shapiro, who's a radiologist. At that time, she was part of this group, and she came back talking about a program that was just started in Boston called Reach Out and Read. And so we met with the people. She and I were part of the education committee. We met with people from the library here in Savannah, and we developed with the library. We helped to develop a program for new mothers and their babies, and every baby, brand new babies, got a little book. It's wonderful. It says, read to your baby, and your baby will read to you. And so this was a program that was then continued into the health center, the pediatric health center, with this new program that I wrote grants to get the money and forced the 100. And they will not deny it because they didn't think it was part of their mission. And I said, it's too important. We need to have our children reading before they come to kindergarten. We don't need dropouts. We need children who come prepared to be able to have education. So Reach Out and Read gives a book, culturally sensitive, age-appropriate, starting about 6 months or maybe even earlier, when the baby's brought by the mother or the guardian, whoever, to the doctor's office, and meets the doctor or the nurse practitioner or whoever. Every time they come, they get another book, a lecture about the importance of reading and communicating with your child, and this book. By the time they're 5 years old, they have 10 books. And that's a critical program. Today, there are 25,000 of those programs across the country. I believe we were the second or third in the country.
Beautiful. Pioneer.
Yeah.
All these, and it would never have happened. And the 100,
leadership.
well, the 100
Oh,
is
yeah.
still giving $25,000 a year to run that program, because, and they also train readers in the waiting room to read. They collect used books. They have a bookcase filled with used children's books. So while children are waiting, older children are waiting, they can pick out a book. They can take it home. Then we have special volunteers who read, show them parents how to read to their children, and so children can go home with books. This program's all over the country.
And speaking of books, Dr. Fields published this book. And you can find it on Amazon and at Barnes & Noble.
Oh, and Shaver's bookstore. Don't forget,
and
first,
Shaver's,
go
yeah.
to Shaver's.
Go to Shavers
Go for
first.
Shaver's, because that's local.
Yes, very good. Go to Shavers. If you can't go to Shavers, get it from Amazon or Barnes & Noble. Thank you very much. Thank you, Dr. Fields. You're just amazing, and hopefully we can promote your story and promote your cause and get those scholars up and running.
I know it's too much. It's way too much.
No. It's